All right.
Unfortunately.
So Alta, we've transitioned, added that into what? Genesis. Okay, but keep in mind, Alta is what you're going to receive in the test. Okay. Who is the clerk? Guess who that is? That's us. All right. Front desk personnel, whatever. We're going to be the clerk. Okay. The clerk cannot deny eligibility for health care. Can only be done by command designated supervisory personnel. Okay, so that's not your job to deny. It's going to be someone who's above you. All right. Deer's eligibility overrides. What is your DD 1172, y'all? What's that? Your spouse might have one, right? That's their ID card. Okay. All other family members recently becoming eligible for benefits, new ID card, expired ID cards, must get a new one in 120 days. Please take that in mind, okay? 120 days. Sponsors entering active duty, newborns, emergency care, sponsor duty stations is outside continental United States survivors. Okay? These are all your overrides. Make sure you know them all. List them all down. Now, Deer's eligibility exceptions, a designee by SECNAV is allowed to give that, or these are exceptions for the Deer's eligibility, right? SECNAV designees and foreign military personnel. Okay? All right, patient categories. Y'all seen this one? All right, just keep in mind, you're 1 Alpha and 1 Bravo. That's your active and reserve. Okay, it makes sense that Alpha is your active duty and your Bravo is your reserve component. All right. Does it mean that you don't want to also remember these? Because they can throw anything at you. But the most consistent ones that I've seen are those two up there.
Just remember there's an Alpha and Bravo. That's what's going to throw you off on the
Yes.
test. So 2 is going to be family members, but there's 2 ones.
You guys got this one? I'll wait. Done. Patient deals with rights and responsibilities. There's a lot to mention, okay? The rights, know what their rights are, and know their responsibility as a patient. All right, remember when you discharge a patient, you go over their patient or their treatment plan, right? That's their responsibility to at least try to be compliant with their treatment plan. Okay? That's why you have a lot of people come back to you and say, I don't feel any better. It's like, first of all, ask them, did you follow the treatment plan that we provided you? Sometimes they may not. All right, and that's why they keep coming back to you. Again, that's their responsibility as a patient to be compliant with their treatment plan. All right, their rights. Every patient is has a right to pain management, respectful treatment. Okay, going back to making that first impression, plays a huge part right there in respectful treatment. Privacy and confidentiality, explanation of care, very important. All right, all these things are very important. All right, so keep that in mind as the provider. All right, this is your part. That's their part, their responsibility. Programs. Drug and Alcohol Program Advisor, DAPA. Please remember that, off that instruction 5350.4 series. Okay. Then right after that's going to be your family advocacy program. Purpose of the program is to identify, treat, and monitor Navy personnel engaging in spouse, child abuse, or neglect. Also, whether physical or psychological abuse is occurring. Navy military personnel command guided by SECNAV instruction 7252.3 and by BUMAD instruction 6320.7. Staff members composed of medical, line, chaplain, and family members, center personnel. Review cases and determine whether a case is to be established and whether abuse is suspected or unfounded. Report to Central Registry at BUMAD. All right. So on this slide, definitely write down those instruction numbers right there. This part. Alright, physical readiness. Policies governing OPNAV instruction is 6110.1 series. What letter of the series are we on now? Say again?
Tequila?
What is it?
The 6110?
Yeah, since we passed Julia already.
I think so. It's one of those ones like the 5100 that just keeps changing.
Yeah, it
every
changes
year.
a lot because the standards keep changing, right? It evolves. So, for this one, all personnel undergo a physical fitness evaluation on a semi-annual basis. That's really not that's gonna be, Jesus. That's gonna be up to the CEO. Some commands just does it once a year, right? That's gonna be up to the CEO. Education, training, and testing advice is provided by the command fitness coordinator. Alright, ACFL's here, that's not you guys, that's not gonna be you, that's gonna be your actual CFL. Okay, you can help by providing training, but you gotta get their blessing for it first before you execute the training that you have in mind. Alright, Freedom of Information Act. It governs disclosure of documents compiled and maintained by government agencies. Written requests for Department of Naval Records that explicitly refer to FOIA must be responded to in accordance with the provisions of the Act. Officials have 20 working days to respond to the requester. Alright, 20 working days to the requester. Privacy Act. Alright, remember this date. Enacted in 1974. Established a safeguard to the right to privacy by regulating the collection, maintenance, use, and dissemination of personal information by federal agencies. Y'all got it? Alright, prisoner patients. How do we deal with them? They fall into 3 categories of eligible beneficiaries. Please know these. Take note. Enemy prisoners of war and detained personnel. They are entitled to all medical and dental care and subject to the availability of care facilities. Non-military federal prisoners, authorized only emergency medical care. After emergency care, transferred to non-military institution to which sentence. So I had one of these right here in my ship, in my last deployment. Our ship had a mission where we had one of the biggest drug busts in the Navy off the coast of Africa. We took those guys in, holding a lot of good stuff, all right? But we also had to take care of those guys on that boat, all right? One of those patients was HIV positive, so I really had to make sure that he was getting his meds. So I took the possession of his medication and I gave to him daily. And I ensured that they were not getting sick from being outside of or just staying in the mission deck, because they weren't allowed to come into the skin of the ship. So I had to check on them daily to make sure they're just doing okay, getting fed, getting the water that they need, all of that. And then finally, military prisoners. An active duty member who is in prison overseas and subject to criminal trial by foreign court normally remain in healthcare beneficiary. Alright? These guys are the military prisoners whose punitive discharge has been executed but has not been completed. The sentence is eligible for medical care and dental care. Prisoners awaiting execution of punitive discharge are authorized medical and dental care. Again, just take note of all these, okay? Know the difference. Alright, that's it. Any questions?